Dr. Paul Offit. Now he is director of the Vaccine Education Center at the Children's Hospital of Philadelphia. Doctor, thank you. All right. Former FDA Commissioner Dr. Scott Gottlieb suggested that Delta, not Omicron, may be responsible for a good portion of hospitalizations right now. It is more dangerous. To you and what you see, is Delta, not Omicron, still the more imminent of the threats?
Well, I think, remember, it's winter. This is a winter virus. So we were going to see a surge this winter either way, whether Omicron came into the country or not. At least what we're seeing in our hospital, Children's Hospital Philadelphia, is before any child comes into our hospital, they're tested to see whether they have COVID. And there's clearly an increase in cases. And they come into the hospital for other things, but clearly an increase in cases. However, there really hasn't been an increase in children who are hospitalized for COVID because of COVID or sent to the ICU because of COVID. So it looks like there's a disproportionate ratio between cases and severe cases. So to date, actually, although clearly this virus has sought out the susceptibles, which generally are children who are either unvaccinated or undervaccinated, it doesn't look like it's dramatically more severe, at least in Children's Hospital Philadelphia.
This is an incredibly important point that you are making, Doctor, and I want to highlight this because it was a headline yesterday out of the New York City or New York State governor that New York City pediatric hospitalizations, and they said sort of associated with COVID, we're up 395%. That's a terrifying headline for a lot of parents. It got national attention. I dug into the data. 395% is technically correct, but it went from 22 to 109 in a city of 1.7 million children. In other words, context is key. So you're saying right now that at least as far as CHOP goes, one of the best hospitals for kids in America, if not the best, that you are not seeing a dramatic rise or any rise in COVID-related admissions?
No, and I think most importantly, most of the children who we admit are over 5 years of age, and therefore all of them could have been vaccinated. And at least when I was on service a couple of weeks ago, maybe the 15 or 18 children we admitted, not one of them was vaccinated, nor were their parents, nor were their siblings. So this is a preventable illness. Please, please, if you have a child 5 years of age or older, get them vaccinated.
Peter Offit, we really appreciate your insight, important context there. Thank you very much, Doctor.